COVID forum focused on restaurants. I think everyone knows that restaurants have been incredibly disproportionately impacted by the current pandemic. So we thought it was particularly important to have restaurant owners, local owners from around Anne Arundel County come in and give the county executive and his staff their thoughts and feedback on how we might be able to better assist and how the pandemic has impacted them. So the plan for today in our forum is to hear from our health officer about the current state of the pandemic and where we are, what the numbers look like, and where we're headed, and then get some thoughts from the county executive on where he is and where he sees the county moving forward, and then offer each of our restaurant guests an opportunity to give their thoughts and engage with the county executive. I'm going to try and keep us moving quickly today. We want to make sure that each of our guests has as much time as possible to give feedback, give thoughts, give recommendations. And so I ask for your patience as I move us along through the 50 minutes to try and maximize our time. So with that said, I'm going to hand it over to Dr. Kellyanne Rahman, the Anne Arundel County Health Officer.
Thank you, Matt. Thank you, County Executive. I'm going to give a brief update on where we are. Bear with me for a couple of seconds while I switch over. So I'd like to start with our principles. It's to eliminate the virus, to keep people healthy, to allow schools to open, to keep businesses open, and really to emphasize that public health measures are the roadmap for a more sustainable recovery. Our goal is to get us back to where we were. Just as a brief update, since a couple of weeks ago, that's November 19th, it's supposed to be today, we've had over 17,000 cases and 288 deaths. It's important. I like to take this opportunity to remind everybody of the symptoms, particularly as we're in cold and flu season. We are hearing that folks are kind of writing off their symptoms as just a cold. The problem with that is that it's hard to know without getting tested that it's just a cold. So keep your eye out for any of these symptoms: fevers, cough, shortness of breath, fatigue, muscle or body aches, headache, particularly a new loss of taste or smell. That's really specific to COVID. Sore throat, congestion, nausea, or diarrhea. And if you have symptoms, don't dismiss them. Get tested and stay in isolation while you wait for the results. If you're positive, we at the health department will contact you. But if you're negative and have symptoms, continue to isolate. And if you need medical help, seek it. Particularly, I wanted to highlight some good news. If you're in contact of a case, quarantine is now shorter, and we are adopting that in the Anne Arundel County Department of Health, and that's going live literally in the next day. Quarantine is going to be shortened from 14 days down to 10 days, assuming you don't have symptoms, or 7 days if you get tested. So we can shorten it by as much as a week. You get tested in the last couple of days, day 6 or 7, get tested, and your quarantine is 7 days, assuming it's negative. And this is a way to make sure that people can actually manage quarantine. And it's based on the data, which shows that there's very little transmission in those last few days of the quarantine. And so, great news. Reminder, progression of COVID, most people recover. Most people have mild or moderate symptoms. But the big problem is that about 10 to 15 cases progress to severe disease requiring hospitalization, and 5% become critically ill. And when I say that the people become critically ill, based on 2018 data, COVID-19 is the 4th leading cause of death in our county, and that number keeps rising fast. Whereas I mentioned, we're at 288 deaths, and that's just a tragedy, to be quite honest. So where are we now? We're seeing that our cases are, sorry about that. Our cases are going up. We plateaued around the 30 case rate level. And in part that's due to people making some changes in November, but we also know that the Thanksgiving data hasn't been accounted for yet. Hospitalizations are going up. Hospital occupancy, which is something new that we're sharing, is fairly high. We like to see that at less than 70%. The reason for that is that means that there's room for sudden changes in hospital admissions. We have our hospital occupancy at 85%. There isn't a lot of extra capacity. In the state, we see the hospitalizations going up, and they're about 1,570 today, give or take, nearing the peaks that we saw in April, May. Percent positivity is up to 7.6%. And our infection rate, while it's coming down, is around 1.04. That means that we're going to stay at a case rate of around 30. An infection rate of 1 means that you stay where you are, and we cannot sustain a case rate of 30 for a long period of time. And our deaths, which we've noted in the past 8 weeks, have been significantly higher than we had over the summer. And for those with sharp eyes, you'll note that some of these numbers, particularly a few weeks out, get revised upwards, particularly as the cause of death gets attributed to COVID. And so we were talking about this being about 7, on average 7 in the month of October. And it turns out it was actually, the average was closer to about 8 or 8.5 deaths per week. Information from our contact tracing shows that the highest risk locations, so the places that people were in the 2 weeks prior to being diagnosed with COVID, work outside the home is the #1 location that people identify, followed by indoor-outdoor dining. Third is indoor retail, and fourth is outdoor recreation. And this is a summary of what we just talked about. And unfortunately, all of our measures are continuing to trend in a bad direction, have been doing so for a few months in terms of the case rate, and over a month and a half in terms of hospitalizations. So I want to show some projections that we are working with. Now, these are projections. They assume that this is what's going to happen if we don't make any changes. They're not predictions of what will happen. And it's projections like these that help us get a sense of what could occur and gives us some information as to what sort of actions we need to take. These projections come from researchers at Hopkins School of Medicine. And what they were looking at here is our hospitalizations, those blue bars, and how they're comparing to that thin blue line, which is what the hospitalization trend was in late March to early May. As you can see, it's almost remarkable. For the past month or so, it's been tracking exactly along that line. The difference is that back then there was a stay-at-home order, and right now there is not. And so that means that we expect that rise will continue even past what we saw in March, April, May. One thing that's slightly better is that we are seeing fewer ICU admissions than we had seen back in the early months of the pandemic. And we think that that's in part because of improved hospital care. We've learned a lot since the spring about how to take care of people with COVID in the hospital. And so that's been a positive sign that we've seen. And because of that, we also get projections for the next 6 months. And those projections, because the ICU usage has been a little bit lower than what we saw in the spring, they've shifted their projection a little bit lower as well, but it's still really bad. They label these scenarios as anywhere from optimistic to moderate to pessimistic to catastrophic. We don't have an optimistic scenario. Nothing that we're doing tracks along that right now. And that's really cause for concern. What they're projecting is, on average, somewhere around 10,000 COVID admissions to occur by around February. Just as a note, our state's hospital capacity is 9,000 during regular times with an additional 6,000 beds for COVID. So a total of 15,000 during this emergency. This doesn't include all the people who are hospitalized for any other reason. And this is why we are concerned. We're concerned because we are looking at overflowing our hospitals. And while our hospitals will do everything we ask of them, It's our job not to put them in that position. So the key principles that we take from this is that hospitalizations are increasing rapidly, and this pace will exceed the number of beds in the state in early 2021. In recognition of this, the governor took actions this week to increase hospital capacity and some triggers if hospitals in the state overall hit certain levels to increase their capacity. If we hit 6,000, 7,000, 8,000 total beds used. There's a delay in this data. So it takes a few weeks for the increase in cases to show up in hospitalizations. It takes a few more weeks to show up in the ICU census. It takes a few more weeks to show up in the death data. So when we see the cases are going up, even we know that there's still going to be more hospitalizations coming behind it. And I think most critically, the effectiveness of our actions multiply over time. So the sooner we act, the more lives we save. And so our recommendations for targeted actions, and this comes in consultation with public health experts at the Hopkins School of Medicine and Public Health, are closing venues that lead to high numbers of contacts, such as restaurants, bars, movie theaters, religious services, etc., with financial support for workers and businesses, limiting gathering size to 10 people indoors, and increasing enforcement. And these, as I note, are recommendations that they make that are targeted to try to limit the impact of this rising case rate and rising hospitalization. There's also individual actions that are critical. Wearing a mask, the science is really clear about this. Avoiding gathering in indoor spaces with others outside your household. We made that recommendation for Thanksgiving. That's the recommendation for the holidays. Limiting activity and travel. Getting tested if you have symptoms or are concerned about exposure. And then holiday celebrations with your household only. And then on the public health side, establishing a system to provide COVID vaccines when available. We are working on that. We have systems in place to provide that to the public. The first doses will be targeted. This is the CDC recommendation that came down a couple of days ago. First doses are targeted to healthcare workers in hospitals and to residents of nursing homes. So they won't be available to the public on the initial round, but will, as more vaccine comes out, we will absolutely make that available once we reach that priority level. We are going to be increasing our use of rapid testing. We are working through what those workflows are and supply chains are, and focusing on equity by providing targeted interventions to disproportionately affected groups, particularly essential workers and lower income individuals, and we see the disproportionate impact on Black and Hispanic communities. So I just want to take a second to acknowledge the folks who have helped us with some of this work. I mentioned them over the course of the presentation, and I'm going to stop there.
Thank you very much, Nilesh. Always sobering and a little frightening the more and more we get deeper into the pandemic. I want to hand it over to the county executive for sort of his thinking and thoughts, and then we'll move on and talk with our panel.
Yeah, thanks, Nilesh. The focus from our end in the county executive's office is both listening to the health officer and doing everything we can to push the numbers down, especially when we get to a place where we are now, where hospital capacity is being reached, and that presents a set of issues of its own. But a lot of the work we do is also dealing with the fact that the folks who are getting hardest hit by the pandemic economically are the low-wage workers, the people who can't afford to miss a paycheck. And so the eviction prevention programs and the utility assistance programs and the food distribution programs and the food preparation programs, which we'll be talking about in a minute, are really essential and a big part of what we have to do. But we do have to make the decisions about what's open, what's closed, and it's been a fast-moving process throughout. In Maryland, the governor doesn't make all the decisions. He asks the county executives to decide within certain limits how much they're going to open and how much they're going to close. So I'm in touch with the other county executives, especially in Central Maryland, on a regular basis. And I want to thank especially the public health people at Hopkins for not only advising the governor, but advising us in Anne Arundel and also other local county leaders to help us understand the data and what's likely to be coming. And those projections, the part that scares me the most are the hospitalization projections that Nilesh was talking about, because we heard from the governor just a couple of days ago, I guess, or was it yesterday? It was yesterday, wasn't it? No, it was just this week. We heard from the governor, the numbers that are pretty sobering, where he actually said we have 8,000 staffed beds in the whole state available. And that as of then, it was 6,816 were occupied. So that leaves, about 1,200 still available for people who are sick, either with COVID or something else. And that if we get up to that 8,000 census, that statewide staffed hospital bed census, then he's asking every hospital to come up with a plan to add another 10%. And when we get to 9,000, another 10%, and 10,000, another 10%. But when you look at the projections from Hopkins, and you see the possibility of 10,000 COVID patients, where right now we have 1,500, 1,600. If we don't do anything by February, that's sort of a disaster scenario, of course, because I was on a call today with some of the state health officials, and I said, well, you talk about a surge capacity of 6,000 beds. Where does that come from? And they acknowledged that really that comes from removing people that are in current beds in the hospitals. There's some excess capacity with in tents outside the hospital, but they don't have staffing for those beds. So that creates a really big problem. And so the reality is that if we don't hold the numbers down and keep that hospitalization scenario from happening, it means that the hospitals are basically bursting at their seams. And so we have to prevent that from happening. So that's the dilemma that we face. And so we've brought in some restaurant owners, and you all are probably, first of all, restaurants tend to be small businesses, and we've discovered that with our new restaurant assistance program, where we put in $5 million of county money through economic development, and then we've got another $5 million of state money coming, that money has gotten out rather quickly, and we may talk about that. We have economic development here in $10,000 grants, which $10,000 maybe, I don't know, a month and a half of rent, depends on the size. It's not even a whole payroll for some restaurants, but maybe it helps some. And then there's the employees of those restaurants when they get laid off because they either close or their capacity is reduced. We hope they get unemployment insurance, but it's not always been easy. And so maybe you guys can talk about some of that as well. So we want to do everything that we can to limit the spread in restaurants. And I have to say that another CDC recommendation that just came out was one that really struck me, which it said that nobody age 65 or older, or anybody with pre-existing health conditions that might contribute to COVID having a larger impact, should ever walk into a building with people who don't have masks, unless it's your household, your family. And that, that has implications for restaurants where people can't eat and drink with a mask on. So while there are distancing requirements in the state of Maryland set forth by the governor, that people have to be served at tables, they can't be hanging out at the bar, and that the tables have to be, distanced and 6 people per table. And we have now 25% capacity. And you guys can tell us what that means indoors in your restaurants, whether you can even function with that. One of the next big questions is, do we continue that way, or do we have to go to where we were earlier, where we're really trying to encourage people to do takeout and not go into restaurants or eat outdoors, which is also problematic in the winter. So we really do face a dilemma with restaurants, and that's why we brought you in, is because we need guidance, and we want you guys to be able to survive this. We know that it's going to be over. I mean, that's the part, unless there's light at the end of the tunnel finally with these vaccinations. And Dr. K has got some confidence. Everybody's got some confidence that this vaccination program is going to work. And the health department is really working hard getting the mass vaccination system set up. So, you know, hopefully spring, summer, we're going to see that enough people are vaccinated that life starts to get back to normal. Certainly, hopefully by fall. I don't want to, you know, make any predictions that don't come true, but there is light at the end of the tunnel. So we can do things knowing that there's an end date to those. And what we have to do is plan for the recovery even before we're in recovery mode. And that's underway as well, which is why we have Preeti Emmerich here with the Office of Emergency Management, who's got recovery work groups that are operating and organizing now. So these are the challenges. I guess the good news is that people are working really hard to solve problems, and we've got here a group of restaurant owners who have been delivering food. And I'll let Monica talk about that program, Feed Anne Arundel, because I think every restaurant that we've got on this call is a part of Feed Anne Arundel. But I mean, you all have stepped up and done something extraordinary, and the county, right from the beginning, was supported financially with CARES money, and I know there are discussions going on about whether we can even expand that. So just thank you all for what you're doing, and I guess I'm sorry that this sucks. Probably shouldn't say that since we're live, but
that's okay. I think everybody collectively in 2020 can say this sucks. Right?
Yeah. So that's where we're at right now.
Thank you, County Executive. Appreciate it. We want to thank all of our panelists for joining us today. We obviously want to get your thoughts on the things the County Executive just laid out, but we also want to hear what you've experienced already throughout the course of this pandemic, what we can do better to help, thoughts on the restaurant relief program. In order to make sure that everyone gets a chance to speak, I'm going to ask everyone to limit your thoughts to about 3 minutes or so to try and cover what you can, and end with a question or end with a recommendation that we can take back and the County Executive can mull on. Why don't we start with Monica, and then I'll run people through, but if you can, say your names or businesses as we move through, we'll make sure that everyone gets an opportunity to provide some feedback. Monica?
Hey, thanks, Matt. Thanks, Mr. Pittman. We appreciate the opportunity to come and chat with you. As mentioned, my name is Monica Alvarado. I own Bread and Butter Kitchen, which is in Eastport, right next to Chart House. And I am also the lead of a program called Feed Anne Arundel, which started in the spring as restaurant restrictions started to get a little bit tighter. The organization ACT, Anne Arundel Connecting Together, approached me and asked me if I would help lead an effort to kind of get restaurants involved in solving the food issues, which is food insecurity in the county. And that idea blossomed to Feed Anne Arundel. And so essentially, if you're not familiar with Feed Anne Arundel, we essentially raise money, both through private donors, as well as we have some wonderful grants from CARES and from the county. So thank you for those. And we use that money to pay restaurants directly to make meals, and then we distribute those meals to food distributions. So it's a significant partnership. We partner directly with the Partnership for Children, Youth, and Family. They are the ones that coordinate all of these food distributions throughout the county. So they make sure that our meals are being distributed equally to North County, South County, West County, Central Annapolis, all the places. And since March, we have made over 400,000 meals. I'm sorry, 40,000 meals. I wish it was 400. Can I get some more money so I can do 400,000? And so we've done over 40,000 meals. We have another 13,000 that we'll be putting out just this month alone. And what that really represents, I know it sounds like food, right? And it is a food program, but more than anything, this is a jobs program. This is a coalition of restaurants working together to stay open and keep our people employed. It's something that most of the restaurants here, even some of the chains, we have everyone from the Chart House to My Little Restaurant to, you'll see the folks that are on the call today. They represent different restaurants across the county. But we all are our families with our employees. And so when you're talking to restaurants about what's important to us, it's really making sure that we're able to stay open and keep our employees engaged and working. So I think there are three primary areas. I know that we restaurants, we talked a little bit beforehand, want to make sure that's addressed today. I'll let everybody else kind of address them because my time will tick to an end because I'm chatty. So there's three things that we really want to make sure we discuss. One is additional funding for Feed in Arundel. We know there's additional money coming from the government, from the governor, and we'd really like to be at the table to kind of talk about that, because the $10,000 grants that we received are nice, but that money we feel could have gone a lot further had they been used to fund Feed in Arundel. So we take that money, we turn that $10,000 into 100 meals and more people working and getting salaries. And so for us, we see that as an opportunity to really be a little bit more strategic with how that money is spent. Because I'll tell you, my $10,000, I appreciated it. It's already gone on bills and stuff. And so it does not stretch, but we are trying to look holistically at how restaurants can really impact the food insecurity issues in the county while also keeping our restaurants open. The second thing I know we want to chat with, and I'll let others talk about it too, is waiving our license fees for 2021. Yeah. Right. Yeah. So this is something that Dina from Grumps, who's here, brought up immediately last week when I mentioned that we were going to be having this discussion. Being able to not worry about paying our licenses next year would be amazing. It's just, it comes right at February. It hits everybody right in the middle of the slow season in a normal time, add COVID to the mix, and it's kind of a mess. And then the final thing that we want to cover, and again, others will cover this as they chat, is we would like some help negotiating or putting some limits on these delivery services that are taking full advantage of restaurants. Everybody's ordering from DoorDash. Everyone's ordering from Uber Eats. They're taking 30%, sometimes more, from each restaurant. We have no negotiating power without talking to each other. We don't know who's paying what. And our restaurant servers who are putting these meals together, making sure they're accurate, are getting none of the tips that go to the drivers. And so there are locations, I think Wahid can talk to this a little bit further, across the country that are putting, the counties and states are putting limitations in and saying to these companies, you may not charge our restaurants any more than 15% period, or you may not be here. We would love to see that kind of legislation go through. So that's my spiel. I'm gonna let other restaurants have a chance. I get to talk to you guys all the time, so we'll let others have a moment.
Thank you so much, Monica. Those are great thoughts. And I know we want to hear a lot more about how we can help your employees as well. So Wahid, I think you're up next if you want to unmute yourself. And I think you're still muted. Sorry, on the very bottom left, there is there you go.
Thank you. This is Wahid from Elevation Burger. Thank you for the opportunity. Like Monica said, that there are some counties, they have limited restrictions on the DoorDash and Uber Eats, like they get 28%, 30%, different people, different prices. That's way too much. If you could help us with that, we will really appreciate that. Putting a limit on them, like 15%, 10%, whatever you think that would be reasonable, but not more than 15%. Shouldn't be. And the grant you gave us, that's really very helpful for us. Now we can help it's already gone, but help our employees. We're keeping them. I didn't have anybody to lay off. All are over here, and this money, that's really helped for all of us. And that's all I would say. I appreciate everything you guys are doing for us.
Thank you very much. Roxana, do you want to unmute yourself? And
hi, good afternoon. My name is Roxana Rodriguez, and I'm the owner of Caliente Grill, a family-owned local restaurant. I think that Monica had explained about Feed in Arundel, but what it means really Feed in Arundel for me. And for my family and my employees, it's that, because of this program, we are open. And I do want to thank for the support from the county with the grants. I wanted to thank all the supporters, and thank you for the invitation from all the restaurants right now. But we need your continued support. I will say that they have already mentioned a couple of areas that you can give us some sort of support so we can continue and see the light at the end of the tunnel. I will think that once the winter is over, we're gonna need support to probably with the permits outside to make, for the outdoor, we're going to probably add a few more spaces, seating, outdoor dining. And I think that sometimes permits, once everything feels like it's normal, once in next year, I think that it will be easier to work together with permits to make it more accessible, faster, instead of, saying, I know that it can be complicated sometimes, but I think that working guidelines, to make things faster. As restaurant owners, all of us know that we need to work faster because, we need to adapt to the changes, to the guidelines, to make sure everybody feels secure. But at the same time, we also need to make sure that we're going to make our numbers so we can really pay the rent, we really can survive and continue to be in business. I really thank you for everything that everybody has done in the group and the county and and all the customers that has really supported us through this pandemic.
Thank you very much, Roxana. We'll move on to Mew, and I want everyone to be as straightforward and blunt as they want as to how the pandemic has impacted them and their employees and sort of what the numbers have looked like for you, what the impact has been throughout the different stages of the pandemic too. I think would be helpful for us to hear.
Thank you, Matt, and thank you for having me today. My name is Mew Ratana Watkul. I represent Mali Thai Restaurant. We're a local small business, family-owned, family-operated Thai restaurant in Glen Burnie, Maryland. And we're in the north part of the county. And, along the line with what the others were saying, we're really happy to have the money coming in. It's definitely a lifeline to be part of this group, Feed and Arundel, and be part of the solution to the food insecurity in our county. And I think what we found just being part of this group is that it really helped us really provide our staff with work and really boost morale. And I think, they're going through this pandemic, this hard time, that's something that we're really grateful for. But the reality is that Howard is not enough to rely on the grants money alone. So we've been pivoting and just really trying to make the business work, be creative, and things like what we mentioned about the third-party delivery platforms, DoorDash and Uber Eats. It's essential to us surviving. So I think, the idea is a strategy of helping us exploring the possibility of even negotiating the price for all the restaurants throughout the county. I think that would be essential to helping us stay afloat. And just in general, I think the ongoing challenge for us is that not only are our employees and us ourselves are fearful of contracting COVID ourselves, a service worker, but I think also, financially, it put a lot of stress on us. Food sales been going down. It's just been enough to keep the lights on as a business owner. And we do have to make difficult choices in the past few months, reducing our staff hours and just really operating just bare minimum, no dishwasher, no server, just to keep the small team doing everything. So I see the increased level of stress definitely on their staff and on ourselves. And I think, just increased stress also really bring down your immune system. So I think that's always been on the back of our mind. So I think just being able to have more of a sustainable financial lifeline through your support with the Feed and Arundel will really help us get through this hump of the next few months. But I just wanted to say thank you for listening to us and all of our concerns and having us here today. It really means a lot to us, and looking forward to talking and discussing some of the ongoing challenges and solution with you all.
Thank you very, very much. You greatly appreciate it. And maybe someone can touch on it as we move forward, but sort of also the impact on the front of the house versus the back of the house and how you sort of work through that with your employees. But I'm going to hand it over to Dina.
Hi, my name's Dina. I'm with Grump's Cafe, and this is my husband, Duncan. We have a location in Annapolis and one in Crofton. It's been a crazy time. When this first started, we're a cafe that does breakfast, lunch, and dinner as a fast casual service style. And overnight, we had to turn into a to-go only restaurant when this first started. We were all terrified. We didn't know what was happening. We didn't know what was safe, what was not safe. But we had to morph. We had to adjust. We had to adapt. So overnight, we turned into a to-go restaurant. We had to keep our door locked. People knocked on the door. We'd open the door, write down their order, lock the door, run back inside, ring it in, and then bring their order out to them. That's it. And that is so hard for us to do that because that's not what we're about. We're about welcoming people in and creating a comfortable environment. And all of that changed overnight. What it did to our staff, we were all terrified. We didn't know what to do, but back of the house staff adapted. So all of a sudden, the people that were in the back of the house came around to the front and helped to package the food to go because we couldn't keep, the servers weren't going to work when they're not making tips. So we had, and when it first started, the servers didn't work. It was my daughter, myself, and my back of the house crew. So we operated like that until things opened up a little bit more, until outdoor seating opened. And that's when we brought our server staff back. So now we didn't have a huge server staff. We had 8 servers. So we brought all of them back, and things worked pretty well over the summer. But anyway, I don't want to go too far into that, but things changed dramatically when we went to 25% capacity. It was almost like that was starting again. So the volume of our sales dropped, 50% easily. So we're back at that right now, and we're at 25% capacity, and we do have a tent outside, and it is heated. So, but nobody wants to sit out there. It's too cold. So the thing that's keeping us going is Feed and Arundel, because that keeps our back of the house crew cooking, and it keeps our front of the house crew putting everything, packaging it to go. So now I can keep my staff because of Feed and Arundel. So it really helps. As far as what would be more helpful is to keep funding Feed and Arundel, because everybody in the restaurant business wants to keep working. They want to keep preparing meals. We want to keep doing this and keep going. So some other things that would help is, all of the fees, like the liquor license is going to be coming up here pretty soon. So that's something. What else?
That's the city of Annapolis.
Well, if you have any influence.
Yeah.
So,
I think what Monica said when she suggested that it was nice to get the $10,000 grant that helped. Having some of the government money go to guarantee the restaurants X amount of meals per day, per week through Feed in Arundel. I think that's money better spent. And we're feeding people and we're keeping people working at the same time. It's a win-win
Yes.
for everybody involved.
and then we don't have to lay people off and they don't have to file for unemployment. But we all want to work. We all want to, being in this business, we're here to take care of other people. That's what we do. And that's how we keep going.
Thank you.
Sorry.
You're fine. Thank you so much. Thank you both.
Thank you.
And last but not least, one of the greatest bartenders I've ever worked with, Jody Danek.
One of the greatest non-drinking bartenders, right?
Very true. By smell.
Good to see you. Thank you, County Executive and Mr. Powers and everybody on the call today for listening. And thank you for everything that you are doing to help keep us in business and to keep us safe. I can't imagine the Herculean tasks that you've had to do to try to satisfy all the different interests in the county during this pandemic, but we appreciate all of your efforts and I want to thank you. I represent, my name's Jody Danek again. I'm a managing partner of 7 different businesses and restaurants in Annapolis and in the county. We've had to jump through hoops just like everybody else. And the interesting thing is, 3 of our businesses are sort of like late night, 2 a.m. type places, 12 to 2. That's sort of an experiential, fun type of environment. That is not happening anymore. Nobody is experiencing fun times in bars. It just isn't happening. So those 2 or 3 businesses that really relied on sort of going and seeing the bartender or seeing a certain server or being part of a happy hour or whatever, meeting your friends. I mean, none of that is happening. So those businesses are suffering in a way that my other 3 businesses, which were already sort of set up for carryout, are not suffering as much. And so I don't know how that can be addressed with different grants or different things, but different businesses were really set up for a carryout experience, whether the customer already expected it as carryout, had experienced it as carryout, or whether the food even travels well. Some things just don't travel well. And some things are too expensive to do carryout. You're not usually doing lobsters to go unless you're at the seafood market. But, steaks and things like that, you're not. You might do hamburgers, but, expensive items, you're not doing as much to go. So those businesses are suffering in a different way. For us, we had to pivot, much like everybody else. We closed lunches because there's no businesses on the street anymore that are open. So the offices are empty. Lunch business is not sustainable. And so we had to cut it off. And that immediately cut our staff pretty much in half, down to the essential workers. As we grew and we started to learn through April, May, June, how customers were going to do, we jumped on board of the DoorDash and Uber Eats wagon, paid up, did what we had to do to start being accepted as a delivery and online service. And it is expensive, don't get me wrong. And it's not transparent really either, because everybody sort of pays a different price and you don't know who's paying what. And so I think there are some things that maybe the county can address with those businesses. I'm not sure how that would be done, but so for us, closing lunches, we reduced our hours. Not only did we reduce because of the restrictions and because of COVID, but obviously the demand is not there. So one of the things that Feed Anne Arundel has done is it's really matched up our capacity and our already in place, basically a factory to put out food to serve people who are in need. And so the only thing missing is how to pay for it. And not only does it serve people in need, but it also keeps the people employed that are most potentially in need for the future, because it's our minimum wage workers or lower wage workers, people that rely on tips, can also be moved into hostess or different types of roles. So it does keep people employed. It's more of a jobs program than anything else, and it also gives us a sense of and I know this might sound a little hokey, but it gives us a sense of community and purpose and meaning. And, you know, even if there's one catering job a day, it makes a huge difference in the morale of our staff, because there's 3 or 4 people in the kitchen, there's 1 or 2 people in the front of the house. And you know, they're putting out the food and then we deliver it. And I mean, it does create a sense of well-being, just working, you know, and, you know, obviously nobody wants to work for free. But so it's a challenge, you know, but having Feed Anne Arundel fund and be able to give us these catering gigs, basically is what they amount to, has really made a difference for Metropolitan Kitchen and Lounge and for Lemongrass Restaurant, both on West Street in downtown Annapolis. You know, we've done the tents, we've done the heaters. Some of the grants, we got a grant from the state, which helped pay for a heater and some tenting. We got a grant from the county a couple months back that helped pay economic development, I guess, that helped pay for PPP and hand sanitizer and extra masks for everybody, and you know, more training. And then you know, just recently we got another grant, thank you very much, of $10,000 that has continued to pay for rents. And what was great about that last grant was that we could pay for rent, you know, because we're sort of at the point where we have a tent, we have the heaters, we need to pay payroll, we need to pay rents, we need to pay the electric company, you know, we need to pay insurance that's due every month. There's a lot of bills outstanding. And so, you know, I know a lot of people say they want to just throw up their hands and maybe close and reopen in March. But, you know, most businesses, I think, want to keep at it, and they want to serve people, and they want to be able to keep the wheels grinding, because once they start grinding to a halt, it's really hard to restart. And it's hard, even if you lose a couple key people, it's hard to bring those people back. It's hard to bring
Customers back.
People, you know, it's not something that's easy to do. So we want to stay open, and really the best way that I think that we can continue to be open is to continue to try to serve community by creating these meals with employees that are already on the job working, and keeping them out of the employment line and keeping them out of the Feed Anne Arundel line. So
Thank you, Jody.
yep, thank you.
Appreciate it. And can I ask?
I always interrupt. I'm sorry, I can't help myself. Did Matt just freeze, or am I frozen? Who's
I
frozen?
think he froze.
He's frozen. Good. Then I can talk over him. Perfect. Listen, I just wanted to piggyback on what everyone was saying. We definitely did not mean for this to be like a Feed Anne Arundel infomercial. I think that the 40 some odd restaurants that have participated in the program with us, you know, we have become kind of our own little coalition of restaurants, our own little restaurant association of Anne Arundel County. And we're still accepting restaurants to come in. So if you know a restaurant, tell them to reach out to us. We would love to have more participate. But I think there's the morale and support that initially happened at the beginning of COVID is something, if everyone remembers, right, there was a big push. All of our customers and the neighborhood folks were coming out, and they were buying gift cards, and they were, you know, they were really trying to support restaurants, even if it was just one meal a day from a different restaurant in their neighborhood. we all have COVID fatigue. So we're not seeing that same level of love and support, which we understand, right? There's a million things to support right now. We just had Giving Tuesday. Everyone's feeling worn out. But we feel that, we see it. We know that when the 25% came out from Hogan a week and a half ago, everybody's income went from here, like just barely staying above the line, to down. And it was immediate. Every restaurant here can tell you they went from like barely getting to break even to where did everybody go? And so those announcements, they're important. I think we all understand we don't want to get sick. We don't want our customers to get sick, but we also are very cognizant of the impact that that has on our staff. And the other thing I just want to just say to anybody that's listening, if your restaurant has the ability to order online directly from them for delivery or for carryout, please take that route first. I have that at my restaurant, and I know Jody has it at his restaurants, and all of us do. If it's just, we literally are paying you to eat our food most of the time, and we tell ourselves that it's good to be relevant, right? We want to be relevant. We want to make sure you can find our restaurants, but ultimately it's really hurting the bottom line of the restaurants, and that's gonna, I think, actually put more restaurants in jeopardy as we proceed. So that's I'm getting off my soapbox, and I'll go back on mute. I'm sorry.
So I know Matt's gotten technical difficulties, so I'm going to jump in. But I know that you mentioned, I'm glad you mentioned that there were about 40 restaurants participating, and that restaurants can still be added. But you listed 3 things that were proposals, and I like that because gives us some specifics to work on. And the first one was, more money for Feed Anne Arundel, and there is still a little bit of CARES money left, and we do want to support restaurants more. So do you have any ideas about capacity? Like how many restaurants, how many meals, how much money could you realistically, per month during the pandemic use effectively? And is there something, I know you have an answer, I'm sure. But I also am wondering if, Feed Anne Arundel is a distribution system that is through all of the, the things that pop up, once a week here, once a week there. People have to drive up and they get the meals, and they get, these big trays of food. Is there possibly some sort of a voucher system that we could create where we know who the people are who've lost income and who have need? And if they had coupons and there were certain restaurants they could go and get free meals, and then you would cook the meals, they would order them and make it all happen like that. Have you thought about that?
We haven't. I know that came up, I think, right before Thanksgiving. We were trying to figure out how we were short, the county as a whole, with the food distribution. There weren't enough turkeys coming out. And so we jumped in, Feed Anne Arundel jumped in, and we were able to get just over 1,000 family meals for 6,000 additional mouths fed. And but that was something that came up. So I think that we would all be wide open to that, especially because, to your point, like some of the people are not going to be able to make it to those food distributions. Some are not with a kitchen. Some, and the food distributions are giving out our meals in addition to all of the produce and the proteins and stuff. But I love that idea. I think it's much more, and it's more adaptable for all restaurants in the county. And, I still talk to people who've never heard of Feed Anne Arundel and they own a restaurant. I'm like, dude, I'm going to pay you. Come join us. It's not I think that's an awesome idea. Yeah. Yeah.
And it might, by creating and promoting something like that, it might also remind people that takeout is an option, and because that would, I assume, be takeout where, we could make it a takeout program where you take your little coupon, your voucher, and you order your meal and you go pick it up. And we need to get people back to that attitude where they're supporting their local restaurants by doing takeout X number of days a week or whatever people can afford. And then I can assure you that Matt is back, and he might be able to actually give you some detail on this, the status of work to try to waive the licensing fees. A little complicated on the liquor licenses, but
I apologize. My electricity went out at the house, and everyone's offline, so apologies. So we are looking very closely at that. We know that's come up a number of times, and we're doing everything we can to figure out the ways that we can try and facilitate that and make it happen. And I don't know if you did this while I was out, but I did want to make sure that everyone knew that Ben Burge from EDC is here, and I'm sure that we can have further conversations about additional uses of the other fundings in the restaurant relief program. Ben, did you want to offer a thought or two on what you've heard?
Yeah. First and foremost, it's great that we greatly appreciate bringing the restaurants and the food service community into a discussion like this. Second, I want to make sure everybody knows, please tell your friends, please tell anybody and everybody attached to the food service industry, the portal is still open until COB tomorrow. So please get your applications in. If you're a qualified restaurant, food service provider, it's $10,000. Food trucks are $5,000. There will be extra money left over. We're going to redistribute some money after that, but please get your applications in by tomorrow. We know we haven't heard from everybody, and we want everybody to apply. We have had a couple large restaurants, a couple large chains who have stepped up and said, I don't need the money. We're doing okay. Let the little guy have it. So this has been a great community effort. My team has been busting their tails, getting the money out the door. We expect to have all the money exhausted out the door, no matter how many applications we get in the next week and a half. And I want to thank my team's effort for doing that. I can tell you right now that if our deadline was May 31st instead of December 31st, we'd still be working just as hard. So make sure you get your applications in so we can get money to you. I think that this has been an interesting discussion. I think, we all agree there's a lot more to do. We've taken some of the, we asked for some people about how they've been impacted from COVID in the application process. And it's all been about like the issues we've been talking on, hitting on today, which has been rent and payroll and rent and rent and payroll. And there's going to have to be a coordinated big picture push on this, as we can't just do our health restrictions here and then address the restaurants later and then this later, and then it's all got to move together so that we can keep all of our businesses, not just our food service businesses, but all of our businesses sustained.
Thanks, Ben. So County Exec, we got about 2 minutes left, and I just want to give you the opportunity to sort of give your closing thoughts on what you've heard today and what you're thinking.
Yeah, well, I like the three proposals. We talked a little about, and we're going to go back and talk about, the additional money and the best way to distribute it. And we'll talk to you about capacity as well. And the limiting, waiving the fees is something that we're working on right now. And I love the idea of trying to do some legislation. Maybe it's just pandemic, for the pandemic period of limiting the percentage that these delivery operations can charge. So we'll look at that. And if you have examples of what other jurisdictions have done, send them to us so that we can, and then we don't have to get it vetted by law and see if it's actually doable. I want to say too that tonight we're doing the tree lighting in Glen Burnie. Normally that's a big celebration with a lot of people. And of course, this year it's going to be a very, very small event, and it'll be streamed live. But during it, we're going to, at about 6:15, we're going to try to do this 300 seconds of silence, which is actually 5 minutes. And I'm a Quaker, so I can handle it, but I don't know about the rest of y'all, but I really encourage you to do that, to honor the 300 people, if you include the 12 that didn't get tested, that are suspected as having died of COVID, and just think about them for that short time this evening. But I also really want to thank all of you for everything that you're doing. You've got a huge advocate as your chief administrative officer in the county. The jokes about bartending were Matt Power. I don't know how many years you were bartending at Rams Head. You might still be doing it. Are you in the evenings? But understands the industry. So thanks everybody, and it's also great to have Preeti Emmerich here, who didn't have a chance to speak up, but doing great work on planning for the recovery. Make sure everybody gets through this.
Thank you so much, everybody.